Good afternoon, everybody. My name is Scott McGann with the Falmouth Health Department, doing our weekly COVID-19 update for May 13th, 2022. If you need to email us, it's health@falmouthma.gov, and our phone number is 508-495-7485. So there's 4,535 cases since the beginning. These are PCR tests only, and a very high number of 122 confirmed PCR cases. Again, that's just confirmed. I'll talk about that in a sec. 18 probables. Those are the ones that you would get from a testing facility like CVS is doing or Convenient MD. Those are not home tests. Our incidence rate jumped from 26 to 39.4. And our positivity went up 1% from 7.31 to 8.82 from the time period of the 24th to the 7th. So there's quite a bit of COVID out there. There's just no doubt about it. It's not anything near like we saw in January. But there is, as you can see in the chart, I got here that marks a dot for every week since the March of 2020 in the caseload, that we're at the second highest count number. And actually, if you drew a line at December of 21, anything to the right of that, there's home kits involved, and we don't get home kit results. So there's some multiplier. Like when you saw the original Omicron back in January at 370, it might have been somewhere closer to 1,000 or 900. There was some number that was much higher. And the same is true now. I mean, most people get a home test. From what I can gather, it's maybe 2 to 3 times higher. So there is a lot of COVID out right now, and it doesn't seem to be showing that it's leveling off. It actually increased a fair amount from this week to last week. This chart here, just the closer the dots are and the flatter the line is, the better we're doing. You can see an uptick, not quite the big spread and a big jump that you saw in January, but you are on an upswing. And you need to think of this as like a wave. You know, there's ebb and flow to it. There's and we're on a rise right now. We haven't exactly crested from where we are with COVID right now. And it's true of pretty much most of the Northeast is in the high category. We'll talk about that now. So we remain in the high. We jumped 29% to 356 weekly cases per 100. That's per 100,000. So you'd multiply somewhere around 2.2 for Barnstable County. That would be the total cases in the county. Same thing with the COVID admissions. We're up 17%. The hospitals aren't in a point where they're anywhere where they were, let's say, in previous waves, the ones that we saw with Delta, the wave we saw more recently with Omicron, the original. You're not seeing hospitalizations nearly at that point, but it is going to go up just by the sheer number of cases. And, there's quite a bit going on in long-term care centers right now. And some of them have a fair amount of COVID, so that's going to go up. It's not where the hospitals can't handle it. They're only at 3.4% of inpatient beds staffed. COVID admissions were 12 for the week per 100,000. So we're in the high category again this week. And when I looked at it, you can get this right from the CDC website, but pretty much a lot of the Northeast is. I think it'll level off and then start to drop. I think more as you get later in the month would be my hope. But these usually have an ebb and flow to them, and we're definitely ebbing right now. So, definitely flowing right now. Again, what does high mean? You start thinking about your personal situation. You might be taking care of somebody who's weakened immune, or yourself with a weakened immune system. Starting to consider wearing a mask in high-risk places if you're a high-risk person indoors. There's nothing coming from the state. There's no state saying that we should start doing any mandates or anything of that nature. So this is from the CDC. The hospitalizations are going to be up by the sheer number of cases, but one's individual likelihood to be hospitalized now with vaccines, 1 or 2 boosters, Paxlovid, and the treatments that you can have within 5 days of getting infected, by and large, will keep the vast majority of us out of the hospital. But there's always those with weakened immune systems that are very elderly that there's going to be more cases, there's going to be a more likelihood of hospitalizations. So if you look at this is the CDC's chart again, you can see that we're on a baseline somewhere where we were for hospitalizations, maybe, September. We had a little up, it's probably relatively close to that. But nothing like you see in January or during January 2021, where it was the most severe, I think, right around in there, where we had a lot of deaths associated with hospitalizations, and we hadn't really vaccinated yet. It was right before we started. So we're not having that, like the daily ICU beds being used. We're nowhere close to where we were January 2021 or 2022, but we are on an uptick. So that's where we are with that. For the state, 5,000 daily cases, and yesterday's with a positivity 8.2. 2 new deaths. You see the deaths not really keeping up, which is great because, again, treatments, vaccines, and boosters. Actually, deaths was 16, but not relative to 5,000 cases. So, if you in 2021, 5,000 cases would have been a much higher number for that. So, trend-wise, again, deaths you see in purple are not, spiking up, but you are seeing a definitely increase in positivity cases, and hospitalizations is going to go up from the number of sheer cases. Not everybody gotten vaccinated. Not everybody's in great health, and so forth. So this one I want to show you for the first time. This is, you can get this from the MWRA, which is the sewer system for Boston, and you can see where they're testing for COVID particles, VRNA, basically viral RNA, and you can see where we are in the far right. We're up from where we were, let's say, places during the fall, definitely where we were maybe a couple of months ago. We're on an uptick. We're nowhere near close to what levels they were getting in January. That's off the chart. And what we were seeing at different phases of the pandemic, like in January of 2021. But it's not coming down. If you take basically this last square, and this chart will show you that. So this is a closer time frame. This is March to May. February to May, and you can see that we're definitely higher and on a little bit of an upswing. It looked like it was sort of tapering off mid-April, but then it sort of stayed flat. Now it's the last few readings from about the 26th to the 10th. You can see where it's gone up. Again, nowhere near where we were before. That we were coming down for that in January, so that spike would have been way, way, way off the chart. This just gives you basically this quadrant in here. And we can track that, and that just gives an indicator of where COVID is regionally. It's not going to give us Barnstable, but if it's up in Boston high somewhere, it's going to be, we sort of follow the same trend. As far as incidence rates in Falmouth, 39.4 per 100,000, we're all high. Provincetown and Wellfleet and Truro, no, not as much. They have less people, a little bit spread out, but the rest of the Cape has been at high 30s to low 40s, with the state average being 41.7. Positivity, we're again at 8, 9, 10-ish, with the rest of Massachusetts being 6.35. Fully vaccinated individuals, these numbers don't change all that much percentage-wise, about 1.5% of hospitalization among those that are breakthrough. So 530,318 breakthrough cases reported since to date. Hospitalization rates have been right around that 1.6, 1.5, 1.6, 1.4, 1.5, 1.6, one in that area. And the deaths among those that have been fully vaccinated has been around 0.5%, give or take, 0.4, 0.5-ish. And so that's where we are with that. Second booster doses, this isn't changed. Anyone over 50 may get a second booster at least 4 months after their first booster, which they can mix and match. And then based on certain medical conditions, you can go either 12 or 18, depending on the different comorbidities, which you can pull off of mass.gov. Vaccine availability, I checked earlier, my nurse Kathy checked this week, and there was plenty of open slots for those who are seeking their first dose, their second dose, their booster, or their second booster. Okay, so there are openings if you just go on vaxfinder.mass.gov. Homebound, again, every week I'll say this, homebound, if you have come back to town and your neighbor has not been able to get out and you notice and they haven't been vaccinated and they're looking, you can just call that health department number, and 508-495-7485, and then or email us, and we'll hook you up with the VNA, so that still occurs. Plenty of spots, and testing, you still go to convenient MD, the pharmacies, the Falmouth Hospital. Most people are using the test kits, which we don't get reported to us, so just keep that in mind. Vaccinations were 235 first, second, and booster doses administered between the 26th and the 12th. Most of them being boosters. There's no breakdown between first and second right now at the state. This is numbers I just pull every week or two off the state. And as far as variants go, original Omicron in purple has died off a bit to a very little percentage. Then that BA2 sort of took over, and now it's this BA2 12.1, and that's working its way back up. So you see that trend. It's all one variant. Within a month or so, it's a new variant. Within weeks, and then, so on and so forth. So as a recap, Falmouth case counts increased again this week, and throughout most of the state and the county, and where CDC is high, there's no low category in the state. There's a couple of counties that are still moderate, and most of the state is on high. Most of the Northeast is either moderate or high. There's, like I said, an ebb and flow, and we're still in a rising stage right now. If you look at MWRA numbers as well, their accounts for COVID. There's still plenty of vaccine and testing capability. The vaccine, there's also plenty, well, I don't know if there's plenty, but there's the availability of Paxlovid, which is taken within 5 days, will definitely help symptoms. And I think that's what's keeping the vaccines in that, so forth, keeping us from having a high hospitalization, high death associated with this particular wave. Plenty of booster doses and second booster doses are available for those over 50. There are no current mandates. The state has not talked about any kind of mandates re-implementing any kind of mitigation, like reductions in capacities and masking. Again, the CDC does, when you're high, want you to consider masking in indoor places. Look at your individual circumstances, and you make decisions right now on your own based on risk tolerance, I guess, and basically make the decisions whether you want a mask. There's plenty of masks available. I actually was walking into a store and they were handing out some KN95s. I was looking to buy one, and they would just handed it out. I don't know if that your results may vary, but there are plenty of masks out there. So that's what I have for an update. We'll continue on doing these updates weekly, as long as there's plenty to talk about in terms of case counts. My hope is, by the end of the month, you would see sort of it level off and sort of come back down. We had if you go way back at the beginning, to jump back, here, you see that our summers in here in the May, June have been historically of the two summers we've had COVID on the low. So my hope is you see these go up and they see them come down, that you'll see this come down eventually, and then, in the summertime be low. That's the hope anyway. So we'll see everybody next week, and thank you.